Hello, today I'm going to present about submarine chop. I have no conflict of interest on the presentation. So dense cataract is very common in Borneo region, especially in a place like Sabah and Sarawak. I'm Y and I'm actually serving in a city called Sandakan, located at the east coast of Sabah. The first case is a 70 years old patient with a Brunnerson cataract. I use a vision blue to stain the anterior capsule. A CCC size of around 6mm is required for this submarine chop, as a small CCC won't be effective for this technique. I hydro dissect as usual to make sure the lens is free from the capsule. Then I will proceed by using a chop mode to remove the anterior epinucleus so that we can see the underlying dense nucleus. Then I turn my bevel facing up and I put in my second instrument, which is a chopper. I use my chopper to gently push the lens away from the incision, and the phaco probe slowly insert at the sub-incision and dive down to the center of the nucleus. I put the chopper as a counter force so that my phaco tip can dive towards the center of the lens without applying too much force on the zonule. I put the chopper at the equator and pull towards my phaco tip, while my phaco tip remain at step 2 and push towards the chopper to crack the nucleus into half. The location of chopper highlight that this is a threat of submarine chop. After that, the remaining case was proceed as usual by using horizontal chop to further sub-chop all the segments. Submarine chop was first described by Dr. Mohanta, where the phaco tip dive beneath the anterior lens surface and dive deep towards the center of the nucleus. It is useful for dense cataract and is a very efficient method for the nucleophractis. However, there is risk of zonal dialysis if the phaco power is not optimized or there is no counterforce from the chopper. I will embed the phaco tip at the sub-incisional area towards the center of the nucleus with the high power and high vacuum in the chop setting, and my chopper will be located at the equator. The phaco tip dives beneath the anterior lens surface and is fully occluded. When my phaco tip reaches the center of the nucleus, I will put my foot position into step 2. This will create a high vacuum and very good holding power, and I will pull my chopper towards the phaco tip and push my phaco tip towards the chopper. This will manually crack the very dense nucleus. This is a second case of a white cataract in a 70 years old patient. When the holding power is very good, you can even pull the nucleus towards the main incision to allow more space for your chopper to enter to the equator. Sometimes when you crack, it will follow your submarine track and crack the heminucleus fully. However, sometimes you have to dial it and crack the other half manually. After that, we completed the cataract surgery as usual. These are my 2 cents on submarine chop technique. Hope you all love diving as much as I do. This photo was taken when I was diving in the only blue ring in Malaysia, which is located in Lahad Datu. Feel free to visit. Thank you for your attention.